Hello, I'm Libby Price, presenter of the Country Hour on ABC Regional Radio in Victoria. It's a weekday program on farming, and as such I was asked to facilitate here at the National Centre for Farmer Health inaugural conference. It's been an amazing gathering of health professionals from around Australia and indeed internationally, an enormous effort for the Western District Health Service. The most important thing from this conference is the Hamilton Charter for Farmer Health, and that charter will be endorsed by this conference and published, and in future we hope to see more interest and indeed political influence on farmer health.
It's my honour to do the official welcome to you to the inaugural Opening the Gates on Farmer Health conference, and it is indeed an honour and a privilege that I've been looking forward to for some time. Farm family health and on-farm safety is an important issue for the long-term human capital and workforce capacity of our farming industries. We know that those in rural and remote areas generally have poorer health than those in major cities. With higher rates of mortality, disease and health risk factors, the research from the National Centre for Farmer Health is indeed helping us get a better understanding of the magnitude of this issue. I trust that you will enjoy these few days of networking with colleagues from diverse geographic, professional and service backgrounds, all of whom have an interest and commitment to farmer health. Ladies and gentlemen, thank you for allowing me to spend some time with you.
This is omega-3 flaxseed oil and dressing and some rolled flaxseed to help us stay healthy. Locally grown. Thank you very much. On behalf of the Organising Committee, Western District Health Service, Deakin University and the National Centre for Farmer Health, welcome to our inaugural conference, Opening the Gates on Farmer Health. So as the world faces further global food shortages and Australia experiences the realities of the impact of climate variability, locusts, fire, floods and water shortages, and an ageing and diminishing farming population, we need to keep our farmers healthy. And we'll be working really hard to do that. We'll be working hard to do that with all the presenters and all the delegates to develop the Hamilton Charter on Farmer Health, which will be a guiding light to us all to continue to open the gates on farmer health, and as we leave the conference and return to our communities, our countries and our workplaces.
So I'm just going to talk a little bit about first the Farming Fit project and then why we decided to make an exercise video. The main points we wanted to get across through the video were: exercise can be undertaken as part of daily tasks. It doesn't have to be an additional thing. Exercise can be done at home and without expensive equipment, particularly gym equipment, and exercise can be undertaken at various levels.
So again, nice neutral spine, slowly lifting up and lowering down.
The conference began with a tour to explore farming practices of the past, present and future. Delegates were given a snapshot of Hamilton history from an agricultural perspective en route to the Hamilton Pastoral Museum. Displays at the museum included historic farm machinery, horse-drawn vehicles and other relics depicting rural life in the past. An old shearing thresher shed, a coach house and the engine shed highlighted the extreme of agricultural health and safety risks in that era. The second stop was the Department of Primary Industries Research Farm, which is shared by Department of Sustainability and Environment and the Rural Industries Skills Training Centre. The tour considered future farming productivity and climate change adaptation and mitigation. After a presentation on carbon sequestration and how it correlates to climate change, delegates visited various field trial sites including high rainfall cropping to improve grain yields, evergraze, new grazing systems, and nitrous oxide, measuring methane gases from farm animals.
The underlying message that I have is one of complexity. Health is a multi-dimensional matter, and sustainable health for individuals and for communities requires well-conceived and well-articulated action, but it's also collaborative action. The main issue for me with respect to health inequalities is that those inequalities are well documented, but not at all well advertised. The inequalities in health services are less well known, but they actually exacerbate the problem of health inequality rather than ameliorating it. The solution is one which involves collaboration of government, non-government, community, including farming families, and focusing on both individual and community level interventions that lead to sustainable health.
As part of the Arts and Health program, the inaugural Celebrating Rural Life photography competition was developed. Entries were received from all Australian states and territories, from Hobart to a remote NT outback cattle station and everywhere in between. Over 250 entries were received, open, secondary and primary categories, and were judged by 3 experts in the field of photography and art. Conference delegates were asked to vote for their favourite photo on the night, and a Delegates' Choice Award was presented. Bainbridge College music students provided lively musical entertainment.
This is a photo of my Kelpie wicked, taken at work just after we'd finished shearing. And she, I guess, proudly ran across the wool packs after a couple of hard weeks' work.
The fortuitous photograph taken while I was doing a farm management course. There's actually 50 sheep in that photograph that had been in the shed a few minutes previously to be condition scored. So the sheep were happily moving out, and I wanted a photograph to actually visually explain their condition score, which you can see best from behind.
It's of the sunrise early in the morning, and it's basically of our whole farm from our house. And I got a camera for my birthday last year, so yeah, ever since I've just been happy snapping around.
I chose the stock hat, stock whip and the boots because my dad used to be jackaroo up in the stations and when he was younger in Queensland, so that's kind of why I chose it.
Okay, it's a photo of my father, who's a dairy farmer in Gippsland, and we had this cow in the paddock next to the orchard, and he was just feeding apples to her, and we were taking some photos one day, and he just said, I wonder if she'd take it from my mouth. So we ended up with this snap, and I think it captures healthy eating and agriculture all in one go.
The Hamilton Charter for Farmer Health, and we want this to be a very brief and evocative statement on farmer health, not just for Australia or for Hamilton, but a worldwide statement that you can take home and use for advocacy purposes and say, look, this is what farmer health is all about, and this is what we need to do in order to move ahead in this area, because there are lots of challenges.
And my dream is that at one day that farmers will not be at increased risk relative to occupational health and safety issues as compared to all other occupations. Now they're somewhere 6 times higher than most other occupations. And one of the ways to achieve that, and one of the 5 keys, and I think perhaps the most important, is to make sure that when agricultural and economic policy is developed, that farmer health is included in that picture. So we have to have almost like an impact statement in regards to what is going to be the effect on the health and safety as we initiate, these new policies in economic and and agricultural policy.
Hi, I'm Dave Rendell. I'm a veterinarian. I'm concerned about the information getting out about neonatal injuries. They can be dangerous, as the picture shows, and the advice on the packets and the MSDSs are inconsistent, and some are alarmist and some are not alarmist, so there's a real problem with them. And some of them don't even actually give details of products that are actually could be quite hazardous, not even on the label. So we've assembled together a surgeon, Kelley done from overseas, another occupational health doctor and nurses to produce a table which people can go to and look up that table and say, well, this, if you're injected by product A, this is the exposure risk, this is the first aid.
My name's Ross Pilkington and I'm a safety zealot. The key message for safety in farms is that we have to turn back time and not do the things of the past. We have to work with the workers and the people on the farm to talk about the things that are going to hurt us, and then to say, well, what are we going to do to fix this, and then go out and actively fix it. You know, and we've got to remember one basic thing, and a farmer from Mildura said this to us in a Win TV ad not so long ago. A farm is not a garden. It's a working factory. The farm he was talking about was an almond farm. So it wasn't a garden producing almonds, it was a factory growing almonds. And kids and factories are mutually exclusive. Safety's easy. Start with the basics, talk to your workforce, identify the problems, fix them and monitor them to make sure they stay fixed. Safety has to become an integrated part of safety on a farm. The only people that can do anything about safety on farms is farmers.
My name's Mollie, Burley. I work for Monash University Department of Rural and Indigenous Health. I'm here to talk to people here at the conference about a network that operates across rural Victoria called the Health and Social Care Interprofessional Network. And what we aim to do is to bridge the gap for people who are currently in practice about this mysterious thing called interprofessional collaborative practice, that there's a big push internationally and from the federal government about this activity. So we bring groups of practitioners together from all over the rural regions into 10 rural hubs, and they talk about various issues to do with collaborative practice, things like chronic disease management in diabetes, or also with mental health or palliative care issues. And we talk around some of the issues that they deal with, and we put different groups in touch with one another. We also have a website where if people want to know what's the quick and latest information on interprofessional collaborative practice, they can access the website and get that information very quickly and easily, so no searching.
The program of concurrent sessions focused on the diversity of issues around farmer health, wellbeing and safety. Topics included agricultural medicine, climate variability, agriculture health and safety, animal health, human health, mental health and service delivery. Key messages were taken from both keynote and concurrent sessions as contributions to the Hamilton Charter for Farmer Health.
So I've developed a website called Friendly Faces Helping Hands, which links rural people and city and metropolitan people to the major hospitals, but the facilities that are located around them. It's a one-stop shop for information, and it puts people in contact with all the support networks that are located in Australia. It's just providing information to help people and try and take a lot of the stress and try and make it easier. There's a lot of people who won't even access medical facilities and things because it is too hard.